Did you know that chronic inflammation is linked to over 50% of global deaths, according to multiple epidemiological studies? From autoimmunity to digestive disorders and even certain cancers, chronic inflammation quietly sets the stage for serious health problems. Today, we're tackling inflammation head-on, particularly how it affects your joints, gut, and immune system. Whether you're dealing with persistent aches, battling autoimmune conditions, or simply looking to optimize your wellness, there are remedies you may never have considered. We'll explore key triggers of long-lasting inflammation, share effective strategies backed by both research and clinical insights, and hopefully guide you toward immediate, practical steps you can implement. Inflammation is part of the body's natural healing process. When you get a cut or catch a virus, your immune system responds by creating inflammation to fight infection or repair tissues. The trouble starts when this process refuses to shut off. Research shows that chronic inflammation can damage your joints, your gut lining, and even your blood vessels over time. Several hidden factors can keep your body inflamed. One is the reactivation of certain viruses, like Epstein-Barr, EBV, which can lie dormant for years. Under stress or low immunity, these viruses flare up again, leading to ongoing fatigue, soreness, and immune issues. Another rarely discussed factor is gallbladder problems. When bile becomes thick or sludge-like, it can irritate tissues near the liver and sometimes create aches in the right shoulder or neck. Improving bile flow with supplements like TUDCA may ease inflammation in those areas. Excess iron can also fan the flames. Too little iron is common, but too much causes oxidative stress and raises inflammatory markers. Some people find that giving blood to reduce iron stores makes them feel better. There's also an ongoing debate about electromagnetic fields, EMFs. Although research is divided, a few individuals say that lowering EMF exposure in places like bedrooms can reduce insomnia and some painful symptoms. Another major topic is diet, especially the high levels of refined sugar and industrial seed oils, corn, soy, canola, in modern foods. These can spike blood sugar, promote insulin resistance, and disturb the balance of fats in your cells. Seed oils have large amounts of omega-6 fatty acids, which may shift your body into a more inflammatory state. Meanwhile, added sugars like maltodextrin or high fructose corn syrup can keep your blood sugar on a roller coaster, further increasing inflammation. Stress makes it worse by boosting cortisol levels. After a while, the body might ignore this hormone, leading to more inflammation overall. The good news is that once you uncover these triggers, you can move from simply covering your symptoms to addressing the actual source of ongoing pain or fatigue. That's what we'll be exploring next. Now that we've looked at some lesser-known triggers, let's talk about what you can do with your diet to calm inflammation. One of the biggest heroes here is vitamin D, known for its strong influence on how the immune system behaves. Research suggests that low vitamin D levels can make your body more likely to overreact, leading to autoimmune flare-ups and long-lasting joint or muscle pain. While some people only need around 2,000 IU a day, others, especially those with diagnosed deficiencies, may go up to 10,000 or even 50,000 IU under medical supervision. It's important to pair vitamin D with magnesium, zinc, and vitamin K2 to avoid any issues like high calcium in the blood. Omega-3 fatty acids also deserve attention. These are found in fish like salmon or in fish oil capsules. Omega-3s help balance the excess omega-6 fatty acids we get from seed oils, which can ease overall inflammation. Many studies show they reduce inflammatory markers in people with rheumatoid arthritis or inflammatory bowel conditions. Even if you can't eat fish every day, a good quality omega-3 supplement can be a game changer. When it comes to food choices, aim for whole, unprocessed items. That means plenty of vegetables, moderate amounts of high-quality protein, and healthy fats like olive oil, avocado, or grass-fed butter. Cutting out refined grains and sugary snacks can help stabilize your blood sugar, which is a key step to reducing insulin resistance, one of the root causes of chronic inflammation. For those with extreme gut or autoimmune problems, some doctors use more restrictive diets, such as the carnivore diet, to remove all possible triggers and let the gut rest. Though it can seem drastic, some individuals see big improvements in joint pain or skin issues. Less strict methods like a paleo or low FODMAP diet can also remove common triggers without limiting your menu as severely. Intermittent fasting, IF, adds another layer of support. Fasting even for 16 hours a day gives your digestive system a break and may help cells clear out waste, lowering inflammation. Start with a 12-hour overnight fast and gradually extend the fasting window if you feel okay. People often notice better energy and less bloating once they adopt IF in a balanced way. Lastly, don't overlook the role of gut bacteria. Good strains can help protect your gut lining from toxins that trigger inflammation. Fermented foods like sauerkraut or kimchi, along with probiotics containing Lactobacillus reuteri, may heal your gut over time. Once you clean up your diet, the next big step is to see how stress, sleep, and movement influence your level of inflammation. Food choices matter a lot, but daily habits can make or break your progress against inflammation. Stress, for instance, can fuel an endless loop of high cortisol. At first, cortisol can reduce inflammation, but if it stays high too long, your body may become resistant to it. Then, inflammation flares up. Techniques like breathing exercises, meditation, or even a relaxing hobby help bring cortisol back to a normal level. Studies show that people who practice mindfulness often have lower markers of inflammation. Sleep is another crucial piece of the puzzle. During deep sleep, your body repairs damaged tissues and balances important hormones. If you're sleeping less than 7 hours a night, you might feel more pain, have worse brain fog, and see slower recovery times. Setting a consistent bedtime and cutting down on screens before bed can work wonders. Some people also like to keep their bedroom cool and dark to support deeper sleep. Physical activity is just as important. Gentle workouts, such as yoga or walking, not only burn calories but also improve blood flow, which helps flush out inflammatory waste. Movement keeps your fascia, the connective tissue around muscles, more flexible, preventing stiffness. Techniques like foam rolling or massage can also help loosen tight areas that trap inflammation. Don't forget about possible environmental issues. Certain household chemicals can irritate your lungs or skin, adding to your body's workload. Mold exposure is another hidden factor. Mold toxins can spark strong immune reactions. As for electromagnetic fields, EMFs, some people say reducing them at night improves their sleep and lowers anxiety. Though not everybody is sensitive, it could be worth testing if you've tried other fixes without success. If you're on multiple prescription medications, check with a healthcare professional to see if they're depleting certain nutrients or if there are better options. For instance, some stomach acid blockers reduce magnesium absorption, which might contribute to more inflammation over time. A careful medication review can reveal problems you wouldn't guess on your own. By combining thoughtful nutrition, stress management, quality sleep, and the right level of physical activity, you set the stage for your body's natural healing processes to thrive. Now let's pull all these ideas together. Building a solid anti-inflammatory plan starts with small, consistent actions. One simple tool is keeping a daily log of your meals, energy levels, and pain or discomfort. Patterns often become clear after just a couple of weeks, like noticing you feel worse whenever you eat a certain food or skip sleep. If you find a strong link, you have a real clue about what needs to change. For sudden muscle aches or joint pain, some have tried the opposite technique, gently massaging or pressing on the side of the body opposite the pain. While not scientifically proven, some people do feel quick relief, perhaps because of how nerves and connective tissues link both sides of the body. It's a harmless method to try, and it might offer valuable clues about where tension is hiding. Emotional and mental well-being also matter. Even light stress can tilt your body toward inflammation. Taking 5 minutes a day to do breathing exercises or write in a journal can help you unwind. In the evening, create a routine. Turn off screens, dim the lights, and consider reading or listening to soft music instead of scrolling through social media. Many people see better sleep quality when they limit bright lights or phone use before bed. If you still struggle, or if you suspect deeper issues like Lyme disease, autoimmune conditions, or iron overload, finding a doctor familiar with functional or integrative medicine can be a big help. They can run tests for viruses, heavy metals, or nutritional deficiencies that regular checkups might skip. If you do have excess iron, for example, donating blood under a doctor's supervision might calm your immune system and reduce organ stress. Keep in mind that chronic inflammation usually comes from a lot of small factors piling up over years: diet, sleep, stress, environmental toxins, or hidden infections. Because of that, real healing usually doesn't happen overnight. Celebrate every sign of progress, like a pain-free morning or a day with more energy. Each positive change strengthens the next. In the long run, combining better eating habits, smart supplementation, stress management, and an overall gentle approach to your body can make a world of difference. No single supplement or diet can fix everything on its own, but a set of good habits can shift your body away from constant inflammation and toward genuine long-term health.